Well, good evening, everybody. Welcome to the little webinar that I'm doing tonight on Iridology and Your Health, and I appreciate the two of you being here. I know that there are other people that are going to probably come on as I'm talking, and then all of you out there in other countries or other states that are not able to be on here tonight, welcome you as well to watch the recording, and I appreciate your time. So let me go ahead and share my screen here. And if everybody can mute, I would really appreciate that. So I'm going to go ahead and talk about iridology and your health, a little bit about the information about iridology. And I am now a naturopath, so I'm very excited about that. And I am an instructor for IPA for CCII 3. So that is Certified Comprehensive Iridology Instructor 1, 2, and 3, levels 1, 2, and 3. We're a sanctioned school and do a lot of iridology teaching pretty much almost all year round. There's my website, joyfullivingservices.com. Email if you want to reach me at iridology@netzero.net. And there's both my office and cell phone if you want to reach me. So first of all, I want to thank you for being here on this lovely Thursday night. And I know there's a lot of other things that you could be doing, but I really appreciate you being here and spending your hour with me. So first thing I'm going to do is go over this disclaimer. Joyful Living Services cannot be held liable for any misuse or malpractice of any techniques taught within this webinar, nor for any injury, suffering, or distress caused by students undertaking the techniques discussed. All students must accept that they are wholly responsible for their actions relating to the practice of iridology and must adhere to the relevant laws in their country and state of residence. Students are responsible for ensuring that they have appropriate insurance for practicing in their country and state of residence. Joyful Living Services cannot be held responsible for any advice given by students to members of the public. Students must adhere to their local laws regarding the requirement for registration and/or qualification as an iridologist before suggesting supplements or offering nutritional advice. So here's a little bit of information about me. I started in iridology in 1983. I had my own personal health issues. A lot of people get involved in iridology because they are interested in helping others. And that was not my goal at the time. I was working at Stanford at the time at the university, and I had my career in engineering. And I fell into this because I was sick and I was dating somebody who had a friend who was seeing an iridologist for endometriosis, and she suggested that I go see her iridologist. So that is when I got started, and that path led me to Dr. Jensen. So, I got so interested in iridology because it worked for me that I sent some of my friends to, his name was Chris Wickert. I sent some friends to Chris, and he helped them. And one day I called him up out of the blue and I just said, how can I learn more about iridology? And he said, well, Dr. Jensen teaches, why don't you call down there? And it just so happened that he was teaching in August and signed up for his beginning class and loved it and stayed for his advanced class and got certified. And that was in '87. So that was a while ago. So I started my career in iridology after that, created Joyful Living Services and my mission and all that. I became a member of IPA in 2018, and I've already kind of gone over that. I'm a comprehensive iridology instructor, levels 1, 2, and 3. I became certified in genomic iridology in 2020. I am writing an iridology book. We actually started it, so it is moving forwards, and I'm in a fellow program with IPA. This was actually down at Dr. Jensen's at his birthday party. I volunteered and took pictures of hundreds and hundreds of eyes for him, and all those years ago. And so David Pesic sent me this picture. I guess he took this of me and contacted me and sent it to me. I didn't even know. So anyway, a little bit about my history. So, the purpose of this webinar is basically to give you another way of looking at eyes. And, instead of just looking at somebody's eyes and say, oh, you have beautiful eyes, which everybody does, it also is giving you another way of looking at someone's eyes to tell them about their health of their body, their genetic tendencies, what could possibly be causing, issues that they may be having. Is it coming from mom? Is it coming from dad? Is it, coming down the line? Is it something that they've, possibly done? Is it genetic? Is it not? And so basically by looking at the eyes, by looking at the iris of the eye and the sclera, we can learn a lot about a person, not only about their health, but also about their personality. There's a lot we can see with iridology. This is a new image that was put out by IPA the other day, and I love this. Why see an iridologist? And so, there's four there's four reasons here. A holistic approach. Iridologists offer a holistic perspective on health, considering the interconnectedness of the body, mind, and emotions. Preventative care. Iridology may detect early signs of imbalances or potential health issues, allowing us to take proactive measures before symptoms arise. Personalized insights. By assessing our unique iris patterns, iridologists can offer personalized insights into our constitution and genetic predispositions. This information can be used to guide you to become the best version of you possible. Empowerment and education. Iridology empowers us to become actively involved in our health by providing information and guidance on lifestyle changes or therapies that may support overall well-being. And kind of the way I look at it is I look at it as iridology is a great way to learn, what may be out of balance in your body, what may need attention, and what your genetic predispositions are, so that when you are 80 years old, you're still feeling pretty comfortable in your body and you're not walking over, hunched over and in pain. So that's kind of where I go with iridology. So what is iridology? Iridology is the study of the color and the structure of the iris of the eye as it relates to the genetic predisposition and health of the body systems. IPA was started to stop diagnosing through iridology. And that was the whole goal for IPA, was to get everybody on the same page and to stop iridologists from diagnosing. We're not allowed to diagnose in this country. Now, I don't know about other countries, but in the United States, it is illegal to diagnose without a license. And so that is why IPA was started. So we look at those genetic predispositions. We look at the colors and the structure of the iris as it relates to the body systems. And, we look at all the markings in the eyes. We look at all the different colors, any of the pigments, the rings. We look at everything in the eyes. And we also do a little bit of sclerology with IPA as well. And so we look at all these lines and marks and colors in the sclera. And with IPA, we're combining the best of all iridology. We are using Jensen iridology, and you can see him there on the upper right. We're using some RAID, which has to do with the emotions of the body. And that's Denny Johnson down here and Ellen Jensen. Jim Vergas also teaches behavioral iridology. And so we've kind of got it all together here with constitutional iridology. So Ellen Jensen, she is Dr. Jensen's daughter-in-law. And before he passed, he asked her to continue on his research. Constitutional iridology, that originated with Joseph Deck and others, used by MDs in Italy, Germany, and Russia as a screening tool. There are correlative medical studies that are being done. It teaches that the eyes are a reflection of genetic or inherent structure of the body. It's not transitional, it's accumulative. Does not give us answers, it tells us what questions to ask. And other iris and sclera changes may continue to become visible with time. So as we age, we usually gain more pigment in the iris. And it's very important to have client intake forms and background information so that those readings aren't cold. It's not always possible to do that, especially somebody like me that works at health food stores and people walk in and they just see me and sit down and I'll offer an analysis. So, when you do that, you don't have any background information, then it's called a cold reading. When you have background information, then it's not. So hold on just a second, I need some water. How is iridology used? Well, by looking at the iris of the eye, we can see these genetic tendencies. And by learning about your genetic tendencies, you can learn what you should eat, drink, what type of exercise you should do, types of supplements, lifestyle changes, anything else that will help you live comfortably in your body, like I said, so that when you're in your 80s, you are not walking around like some of these people that I see that are so miserable and in pain and uncomfortable and, just really miserable. And iridology doesn't name any diseases, but it can show us what areas need nurture or what body systems need strengthening. And by this, we can look at any types of markings in the eyes here, and we can see basically wherever these markings land in the iris, what may need balancing, what may need nurturing, what may need detoxing, and so on and so on. So what can iridology show us? Those are my eyes. Look at that, 2006. What can iridology show us? It can show us our inherent strengths and deficiencies of organs, glands, and tissues. It can show us the potential ability of an organ to react to illness. It can show us familiar patterns of various syndromes and pathologies. In other words, you can follow the family down. So if you have pictures of, your grandparents and your parents, and then you have children and you have grandchildren, you can see some very similar markings in all of those irises. This can also help us to tell certain foods that a person could have difficulty digesting or utilizing based on the markings and the lines and spots and so on, everything that shows up in the eyes. And it can show us areas of the spine that may have subluxations, potential central and autonomic nervous system imbalances, potential circulatory disturbances, connective tissue weaknesses. Notice the word potential is on all these. Potential for glandular deficiencies and for high uric acid levels, serum cholesterol levels, and lymphatic congestion. The reason it says potential is because just because it shows up in the eye doesn't mean that there's a problem, okay? Just because it shows up in there does not mean a person has that's a symptom or a health issue, okay? It can be genetic. Just because it's genetic doesn't mean that it's causing a problem. It has to do with how a person lives, how they live, how they think, what they eat, what they drink, who they love, and so on, so on, so on, so on. Okay, so just because it shows up in the eye doesn't mean that there is a problem. There's a potential for it, and that is those genetic tendencies. There's a potential. So it doesn't mean that there is a problem. So what are the things that iridology cannot show us? Well, it can't diagnose us. That's it. We don't diagnose here in the United States. So we don't diagnose or give the name of any disease a person may have or have had or identify any type of pathology. If somebody wants a diagnosis, they need to go to a doctor, get a diagnosis, and then if they want to work on their body, then we can help them with that. Okay? Determine if a person has had surgery. That doesn't show up. Indicate precise blood pressure levels. Well, we can use a blood pressure cuff to figure that out. Determine if a person has parasites or indicate the presence of yeast infections. We can see some of that, the potential for it, especially looking in the sclera. And there are some markings that can show up in the eye that can show us the possibility or the probability that they may have or possibly can have parasites, but we can't diagnose that. We can use other types of scanning programs that can help us with that. Okay, it cannot show us, it can't confirm the presence of viruses, germ life, or bacterial invasion, determine if a woman is pregnant or has had an abortion, indicate whether a tumor is present, what size it may be, or show if a person has kidney stones or gallstones. So somebody asked me if I talk a little bit about the sclera. In sclerology, we can see things that are going on now. So with the iris, we can see those genetic tendencies. With the sclera, we can see what's going on now. And as a person improves their health, then the sclera will change. Okay, we can see those changes. So the pretty yellows that you see there, the reds that you see there, the blue rings that you see there, a lot of those can go away in the sclera as a person improves their health. And as far as viruses and germ life or bacterial invasions, you know, there needs to be other tests for that. We can't see that in the eye. Okay. We can see the possibility, maybe there could be something happening in the body, but to find out if there's a tumor, you know, there needs to be scans and things like that, you know, and the same thing with kidney stones or gallstones. There needs to be other testing that is done. Okay, it can't show us the exact cholesterol or uric acid levels in the body. However, what I've done here is I put a picture here of a woman that has problems with cholesterol and triglycerides and HDL and LDL. And this lady has had a lot of problems with that. And this ring is a indication that there may be issues with that. But just because somebody has that ring in their eye doesn't mean that they have high cholesterol or high triglycerides or high sugar or high blood pressure or low blood pressure. It doesn't mean any of those things. Okay. It means that they have the potential for it. They have the genetic, they have the predisposition, but it doesn't mean that they do. There again, it depends on how they eat or what they drink, how they live, who they love, and all these factors. Okay. Iridology cannot determine if hemorrhage exists or where it's located unless it's located in the visible layers of the eye. And you'll see that, you know, here in the conjunctiva here, you'll see it in the sclera. It can't show us if arteries are blocked or hardened, although the potential can be seen in the sclera. And whenever we see these vessels in the sclera, this has to do with circulation to those areas of the body. It cannot distinguish the gender or age of a person, predict a person's lifespan, or impending time of death. It doesn't do any of those things. I wouldn't want to do that anyway. Okay. And it can't tell if a person needs surgery. That's for a doctor to determine, you know, if a person needs surgery. Cannot locate a specific tooth that may be problematic. However, since all your teeth are, you know, they're all connected to different parts of the body. If a person is having problems with a tooth or a part of the body, then we can look to the teeth for that. Show if a person has ingested poison or been bitten by a poisonous spider or snake. You know, iridology can't do any of those things. So here I've listed 3 iris colors. Now with Jensen iridology, he said that there were blue and brown eyes. And that's it. So here we have blue lymphatic, we have mixed biliary, and we have brown hematogenic. Blue-eyed people tend to have issues with their immune systems, their lymphatic systems, okay, and their respiratory systems. Blue-eyed people tend to be more mucousy, tend to get more problems with tonsils and adenoids and lungs and bronchioles, tend to have things like bronchitis and pneumonia, tonsillitis. They tend to get mucousy. They usually don't do real well on dairy, anything that's mucus forming, dairy, wheat, any of those kinds of things. Okay. And mixed-eyed people, these are people that have both the blue and the brown. They're mixed. Okay. They tend to have more digestive issues. Okay. They tend to have more problems with the stomach and the liver and the gallbladder and the colon and the small intestines. Okay. Pancreas. If there's a lot of orange in the eye, like this one, then they tend to have more issues with blood sugar. Okay. Blood sugar issues like you would say hypoglycemia or diabetes. But just because we know that about a mixed biliary person, we cannot diagnose that. Okay, if we have somebody that comes in that they're pre-diabetic, then we can work with them. Okay, but we can't look at their eye and say, hey, you're diabetic. That we just don't do that. We can't do that. Okay, and a brown hematogenic, they tend to have more issues with blood. They tend to be more anemic. They tend to have more problems with blood and bones, glands and things like that. So it really depends. You know, not only are we looking at the colors of the eyes when we're looking, but we're also looking at what's called subtypes. And those are the different patterns that show up in the eyes. This is my eye, by the way. And so when I got involved in iridology and I told you that I was ill, It's my first recollection when I was about 12 years old, and we had gone camping. When we used to go camping as a family, we went out to dinner once, and I still remember it like it was, last week, even though I was 12 years old. And I remember we went to dinner, and of course, my parents have talked about it all these years. We went to dinner, and I had a huge plate of spaghetti. I do not remember eating all of it. I do remember it. What I remember mostly is that I was sick all the way back in the camper, back to the campground. And that was my first recollection of having bowel issues. When I got into my 20s, I was having chronic bowel issues, lots of stress. I was dating, and we know how fun that is. I was dating, and so I was having constant bowel issues. For me, I tend to have irritable bowel syndrome. So it's that alternating constipation and diarrhea, eat something and purge. So I was really having a hard time. I couldn't go out to eat anymore. I was pretty much eating almost, baby food and cottage cheese, which I didn't know was bad for me at that time. I was broken out in hives, and I had a lot of back pain and couldn't lay flat on my bed. So that's where I started. That's where I started with iridology all those years ago. And so, in looking at my eyes here, we can see that the center here is the darkest area of my eye. Well, that's digestive system. So right there, that's telling me that, genetically, this would be a genetic predisposition for me. Okay. And then these rings, this has to do with genetic stress. And so I had lots and lots and lots of stress. Now, all these years later, my eye looks exactly the same. It hasn't changed. It hasn't gotten lighter. It hasn't gotten darker. It's the same. I have done many, 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 many detoxes, gallbladder flushes, liver flushes, colonics. I've done all kinds of herbal cleanses. I've done all kinds of things. My eyes haven't changed. My health has changed. My bowels are great. I'm not breaking out on my skin. I can lay flat on the bed. I don't have any of the problems that I had then now. But my eyes haven't changed. And so that is a really big issue with iridology. Is there are iridologists out there that will tell you that if you go on a detox or you go on a cleanse, your eyes will change from hazel to blue, or they'll change from brown to blue. And with iridology, what we've learned is that really this is genetic. We're looking at those genetic predispositions. And a lot of the markings that we're seeing are from grandparents. And most of us don't know anything, or we know very little about our grandparents' health. So that it's very interesting. As we continue to research, we'll continue to learn more and more about how the eyes change. What really changes is, what we really see changing is the sclera. So here's a better picture of that blue eye. And with a blue eye, you can really see the fibers in the iris of the eye. We can see the fibers really nicely. And blue eyes can look blue, they can look green, they can have little pigments in them. We can see multiple things in a blue eye. In a mixed eye, we're going to have both blue and brown. We're going to have orange. We're going to have yellow. We're going to have all those pretty colors. Sometimes we can have black pigments and so on. And with a brown eye, that's all we see. We just see brown. Okay, it's just the pigment sitting on top of the iris. And so with a blue eye, we can see all the fibers. With a mixed eye, we can see the fibers with the pretty colors. And then with a brown eye, we just see brown. It kind of has what I call that velvety texture. We just see brown. We don't see anything else. But even with a brown eye, we can still see so much. It's amazing what you can see with a brown eye, because you just don't look for the colors. You're looking for the other types of markings that show up in hematogenic. Okay, so as far as legal wording, iridology does not diagnose, but instead it analyzes or assesses predispositions and genetic inheritance. And so we're looking at, this is amazing here. This is beautiful, isn't it? This orange, and here we have a little orange spot here. So we're looking at all of these lines and spots, these rings here, rings on the outside. And these all tell us about these genetic predispositions or the possibility of these genetic predispositions. And a lot of times when you see these genetic predispositions, this really helps a client because a lot of times they are already having issues in those areas. So, it's very important when we look at the eyes that we look at them with reverence, honor, and respect. I mean, this is one of my clients here. This is a lady that I've been seeing for over a year. And she came to me and she was so sick. She was so sick. She was so unhappy and so sick. And so, when we're looking at somebody's eyes, we know that we're looking at them. We're not only looking at them, but we're looking in them, not only at their health, but their emotions as well. Okay. And so, we're very dedicated and sincerely concerned with the interest of everybody that comes in to our profession. So here I'm going to talk just a little teeny bit about the history, give you a little bit of history. Iridology is in Australia, China, Egypt, Greece, India, Italy, Europe, and here in America. And it's rooted in ancient history and ancient cultures. It's an ancient practice which dates back more than 3,000 years in China, Egypt, and India, where it was first used to study the iris and its relation to the organs and systems of the body. So just think about it. Everything that we know now in iridology, I mean, it started all the way back 3,000 years ago. And, little by little, there's been research that's been done, and we're building and building and building. It's going to continue on. Everybody that's teaching iridology, everybody that's out there seeing clients, everybody that's practicing, we're all doing our own research. And it will continue. We'll continue to see the changes. So as science evolves, we need to keep pace. And we need to continue to change with the science. So here, I've got a few little slides here. This is King Tut. And you can see here that in 1922, there's an archaeologist named Howard Carter who discovered silver plates while exploring King Tut's tomb. And it's thought that the silver plates are some of the first lessons of iridology, dating back thousands of years in Egypt. Okay, from there, it spread from Africa, it spread to Babylon, Tibet, China, Europe, and other areas. But it goes all the way back. And Ignaz von Pessely, he was a Hungarian physician. You can see 1826 to 1907. This is where the story of the owl came, where supposedly this owl got stuck in this tree, he freed the owl, and a line showed up in the bottom of the owl's iris. And there's questions about that now. Did it really happen? Because, of course, nobody's been able to replicate this. But the key here is that in 1881, he published a book called Discoveries in the Field of Natural Science and Medicine, a guide to the study and diagnosis from the eye. So he was able to use that then, but we can't use that now. And it was in this book that von Pessely built up the first known accurate chart of the iris. So all those years ago. And here we have, of course, Dr. Jensen. And in 1950, he pioneered the science of iridology here in the United States. He developed one of the most comprehensive iridology charts showing the location of the organs as they reflect in the iris of the eye. And, even now his chart has been changed, or let me say his chart has been improved by Ellen. Okay, so Dr. Jensen wrote a book called The Science and Practice of Iridology. And like I said earlier, before he passed, he asked his daughter-in-law, Ellen Jensen, to continue his research. And she created the NIRA, which is the National Iridology Research Association, which then became IPA, which is the International Iridology Practitioners Association. So we're still, even with IPA, we're still connected to Dr. Jensen. And here is some information about IPA, and I'm here. This was one of the instructor meetings that we had. This is their IPA's website. Everybody that becomes a student will become a member of IPA. That is the rules for IPA. And IPA was founded for the purpose of increasing and communicating knowledge concerning the art and science of iridology, and to provide a forum for the exchange of information and research. Really, it was created to stop diagnosing, okay? It was created to get everybody on the same page and to work so that we can not diagnose here in this country. Very important. So here's some other information, that you can look into. Here's Bernard Jensen, and here's information on RAID. David Pesic, he has an iridology college actually coming up in October. Tony Miller, she's in Australia, and Jim Vergas does behavioral iridology. There's emotional iridology. So if you're kind of wondering why somebody ticks, why they do something the way they do, why they behave the way they behave, and there's some things there. Mercedes Colburn, she teaches equine, feline, and canine iridology here in California. So if you're interested in looking at dogs and cats and horses, there's courses for that as well. And IPA doesn't teach these, but there are other people that do, and so it's great. You can learn iridology for dogs, cats, and horses and humans. This is the updated iridology chart. So this was developed by Jensen and updated by Ellen Jensen. And basically she color coded it, which, and she added some things that were missing. She's got iris zones down there that are color coded, and she's got all the abbreviations in there. And she's got the original brain flare chart up here. This was from 11 to 1 up here. So she's got Dr. Jensen's original brain flare chart. But basically the way iridology works, it's just like your body. Here in the center is your stomach. This is your stomach here. The right eye shows the right side of the body. The left eye shows the left side of the body. This is the left side of the stomach. Okay, we have the small intestines. Here's the left side and the right side of the small intestines that come down. You have the cecum going across, ascending colon, transverse colon across your belly button, descending colon, sigmoid and out. Outside of your body is your skin, and here's the skin right here in zone 7. Okay, that's the skin reaction field. Top of the body up here, this is your head, your brain, and your sinuses, and so on. So from 11 to 1, this is your brain here. Here's your sinus. Okay, that's the right side and the left side of the brain. Down at the bottom of your body, you have your hips and your thighs and your legs and your knees and your feet and your toes and all your lower organs, your adrenals and kidneys and pelvis and ovaries and testes and so on, so on, so on. So right here at 6 o'clock, there's the hips and the thigh and the knee and the feet. And here's the adrenals and kidneys and the appendix and the pelvis and the groin and the testes and ovaries and so on and so on and so on. So you have it on both sides. Over here on the outside, this is the lungs and the breast. These little lines here, this is the ribs. And here's the heart and the bronchioles. Okay, same thing on the outside over here. On the inside, we have the bronchus here in the throat, the throat area. We've got the thyroid, the parathyroid, and the vocal cords. Okay, so on, so on. And here we have the spine. So up here, this is the atlas, the first vertebra, and down here's the tailbone. Here's the liver. Everything is in there. So when we see any kind of little marks or spots or lines, wherever we see these things, this can tell us where there could be these genetic tendencies, which may be causing people some issues. Okay. So, this chart is broken down into many ways. You can see that it's broken down here by like a clock, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. It's also broken down by the area of the body. So you can see here, brain, face, throat, upper back, lower back, pelvic, lower abdomen, upper abdomen, thorax, lung, neck, and so on. Okay, and so these are all the various areas, all the different parts of the body. And so wherever we see any of those lines, any of those rings, marks, pigments, depending on where they land in any of these areas, that can tell us, where there may be issues. But what we do is, rather than tell somebody that they have an issue in that area, is we ask. And we ask. Just because somebody, like I said, just because somebody has a marking in a particular area doesn't mean that they have a problem or that they have a symptom or that they're going to have a problem. Okay. So let me show you a couple iris signs here. Here's what we call a circulatory ring, and it shows up outside the iris. It can be a very bright blue. It can be a dark blue. Here you can see it's blue. It's kind of a grayish blue on this eye. Okay, usually people, when they have this ring, a lot of times they'll have cold hands and cold feet, can also have neuropathy. Maybe they're not walking enough. Maybe their circulation isn't great, but we need to ask. We can't just say, oh, you have poor circulation. Okay, we need to ask, do you have cold hands and cold feet? And most of the time, somebody's going to say yes. Do you, get enough exercise? Maybe not, not necessarily. Okay, but just because they have this ring doesn't mean that they have circulatory problems. They might not. Contraction furrows, there's my eye again. Contraction furrows, it's these rings. Okay, we can call them nerve rings, we can call them stress rings, we can call them anxiety rings. I certainly had lots of anxiety when I was in my 20s. I've had anxiety attacks. So it definitely runs in my family. Both my mom and my dad have these same rings and the same color in their eye. My daughter has the same rings and the same color in her eye. She's had anxiety attacks. My dad's had anxiety attacks. Okay. Does it mean that just because somebody has these rings in their eye that they're going to have anxiety attacks? No. Does it mean that they may have stress? Sure. Almost everybody has stress. I don't know anybody that lives on this planet in this human existence that doesn't have some stress. But really what it depends on is how we deal with that stress or that anxiety, okay? Or that, how we deal with it. And so depending on how many rings there are, what color there are, if they're white, if they're dark, how many are there? Is there one? Is there two? Or there, I think I had like 6. And depending on how many rings we have, what color they are, that makes a big difference. Okay. So when the rings get very white, usually means we're very stressed. If they get darker, it can mean maybe that you're calm, that maybe it's not bothering you as much as it could. Okay. So these do change, but they don't go away. These rings do not go away. It's just showing me that, you know what, if I go back to the way I was when I was in my 20s, if I go back and I start eating the way that I ate when I was in my 20s, and I started dating again, or forget that, if I start dating again, or I start doing the same things and dealing with my life the way I dealt when I was in my 20s, I'd go right back and have the same problems. Okay, because those are my genetic tendencies. My genetic tendencies are to have these bowel issues. Now, I did find out that my mom has IBS. My grandmother, her mom, had IBS. My great grandma, which was my mom's grandmother, had IBS. They didn't label it then as IBS, but they had the same problems. And I didn't know about that until I went on a cruise with my parents. We went on a cruise and my mom was in the bathroom like every 10 minutes, and I'm like, well, what's going on with you? She says, well, whenever I travel, that's what happens to me, but it's not only when she travels. If we go shopping, she's in the bathroom every 10 minutes. So she's still having those issues. So I'm happy that I don't have those issues. I've really worked with my digestive system. I've detoxed, I've built, I'm always working with it to help so that I'm not dealing with those problems. Healing lines. Would it be okay to say healing lines when the contraction furrows are gray? Hi, Jackie. We usually don't use those terms anymore. Those are old terms. So we usually say that things have kind of calmed down. So thank you. That was a good question. So anyway, that just kind of shows you. So my eye hasn't changed. My eye hasn't changed in all these years since 1987. Hasn't changed because those are my genetic predispositions. Okay. And if I go back to doing what I used to do, I'll go back to having the same problems. So I'm constantly working on my body, constantly checking my body, making sure that, I'm working on those things that need to be worked on. And that goes for anybody. If you go back to eating things that you used to eat or doing things that aren't good for you, that maybe you stop doing, then what's going to happen? You're going to go back to having those same problems because those are your genetic predispositions. Lacuna. A lacuna looks like a hole. It looks like a hole in the fabric of the iris, and you can see it there. I've got an arrow there. That's what it looks like. And that has to do, that's an area that may not be absorbing nutrients or releasing toxins as well as it needs to. There again, we need to ask the person, are you having problems in that area? Or maybe that's why they're coming to see me, okay, or coming to see you if you're working with people, okay. That may be why they're coming, because they're having a problem in that area. Okay, but we can't look at the eye and say, oh, you've got a problem there. That means that you've got parasites, or that means you have bacteria, or that means there's a tumor there. We can't do any of those things. Okay, we can look at the eyes and we can see the colors. We can see that there's yellow here, and there's orange here, and there's brown here. And these colors have been linked to various organs. Okay, so for instance, yellow has been linked to the kidneys, and orange has been linked to the pancreas, and brown has been linked to the liver. And out here, when we look at the sclera, this yellow in the sclera is being linked to the liver. So we can ask the person, if they're having problems with their blood sugar, okay, if they're having, or maybe they come to you because they are pre-diabetic, or maybe they are diabetic, or maybe they're going long periods of time without eating and they're having that blood sugar fluctuation, okay, and that would be linked to that orange color. Okay, maybe they're having problems with their stomach and their digestion, okay, and that would also be an indication. That orange there would be an indication. Or maybe they're having trouble, with their liver. Okay, they're having problems breaking down fats. Maybe they're having problems with their gallbladder. They eat something that's fatty and they feel sick afterwards, so on and so on. Okay, but for us to actually say it and to diagnose it, we can't do that. But we can ask the questions. We can ask the questions to help people figure out what may be going on in their body if they don't know. Okay. Okay, lipemic diathesis, that's the same as the picture I showed you earlier with the lady with the two, with both her eyes with the round ring. And that ring can be yellow like this. It can be white like the one that I showed you. This is a corneal sign. It's not an iris sign. And if it's seen in somebody that's 40, we really pay attention to that. That may be somebody that may have issues, okay? This lipemic diathesis, lipemic has to do with fats in the blood. Okay, diathesis means that it's genetic. Okay, so this can have to do with a genetic predisposition to having high cholesterol, high triglycerides, low HDL, high HDL, and so on and so on. Okay, so if we see that ring in the eye, it can mean that there may be issues with cholesterol. When I worked at Stanford, I worked in the engineering department at that time, and I was working with iridology. And I learned about a study that Stanford did, and they said that when somebody has this ring around their eye, that they're more likely to possibly have a stroke. But at the same time, they did not acknowledge iridology at all. Okay, so when we see these rings, it doesn't mean that somebody's going to have a stroke or a heart attack, but it could mean that genetically they are more predisposed to having circulatory issues. Okay, and so we wouldn't know that until we did the tests. We'd have to, do some blood tests, other kinds of tests to find out, if there are any health issues. I do have a client that has a ring like this in their eye. Both his mother and his father died of circulatory issues. And he wanted to make sure that, he was going to be okay. And so, we looked at his eye. Sure enough, he has the same sign in there. And in checking his cholesterol, his triglycerides, his blood pressure, and his sugar, and all those things, everything is good. Okay, so right now, what he's doing right now is good. He has the predisposition to it. So, he needs to make sure that he will, continue to do the right things for his body. Okay, pigments. Lots and lots of pigments can show up in the eye. Here you can see that I put arrows here. There's a black pigment and a brown pigment and an orange pigment. There's yellow in here and orange and so on. And so depending on where those pigments land, we can look at those areas with the chart. Sometimes it has to do with MTHFR, which has to do with methylation, liver methylation. Sometimes it has to do with certain medications. Okay, if people are taking certain medications, they can show up as pigments in the eyes. And then if they stop taking those medications, those pigments go away. So, it really depends on what the pigments are and where they would you check the ankles if you saw that sign? Which sign? Jackie, which
The
sign?
one before, the slide before.
This one?
Yes,
Check the ankles?
for circulatory.
Yes. Oh, definitely. Yes. You mean to check for swelling? Is that what you're
Yes,
talking about?
yes,
Yes. Ankles, fingers. Yeah.
yeah.
Check for swelling. Yeah. Okay. So pigments, they can be yellow, they can be orange, they can be brown, they can be black. Black usually means that it's genetic. It's been there a long time. And so, just look, when you're looking at the eyes, you're looking at all these different pigments and looking to see where they are and what they can mean. Okay. And a scurf, this has to do with the skin. So this is on the outside. Remember, the outside of your body is your skin. And this ring, I mean, it's really pretty. You stand in front of this person, they look like they have green eyes, and they look like they've outlined their iris with, black ink. But you can see here with the scurf rim, it's a thinning of the iris fibers, and you can really see it here. You can see because underneath, the very bottom layer of the eye is supposed to be black. Okay, it's the very, very bottom layer. What you're looking at here is the top. You're looking at the top layer, and that's where the yellow sits. All the different colors sit on top. And so what you see here is you see a thinning of these fibers. This doesn't go away. We used to think that the scurf rim would go away if you skin brush for about a year. And we have since found that it does not go away. It doesn't go away. It stays there. This is a genetic predisposition. It's showing us that this person has a potential for the skin not eliminating as well as it needs to. Okay, is what it's saying. And tophi, all blue eyes have these. These are these little dots that go around. This is the lymph. This is the immune system here. And we see these little dots and they go around here. And they can be white, they can be yellow, they can be orange, they can be brown, they can have pigments in them, they can be large, they can be small, they can come inside here in some of these other zones, or they can be right outside here at the perimeter. It just really depends on the person, and that has to do with the lymph. So sometimes it can mean that the lymph is swollen. Sometimes it could be the person's not having any problems at all. It really just kind of depends. Just really depends. And so we really need to talk to the person, talk to the client, ask them the questions. Okay, so in iridology, we also look at the pupils. Okay, when we shine a light in the pupils, in the eyes, the pupil is supposed to contract. Okay, and this is somebody that the pupil hasn't contracted. So this is normal for children. Children have larger pupils, and but adults are not supposed to have larger pupils. And here we have very tiny pupils. Okay, so this is really contracted, very small, too small. Okay, so the pupil should be bigger. It should be right about in here, a little bit larger than this, about a third. Okay, so this is very, very tiny. And usually when the pupil is large like this, it has to do with adrenal fatigue. Okay, person is just kind of burning the candle at both ends. And when it's tiny like this, they're usually very uptight, very, very uptight. And then here's some sclera pictures. So in sclerology, we'll look at the different colors, the pink and the yellows. Sometimes we can see gray in here. We can see brown. We look at all of these different veins, kind of, where they're going, what's their shape, and all those things mean something different. The shape, if they're wiggly, if they're straight, if they're going right into the iris, if they're looping, if they look like a cane. Sometimes there'll be spots like brown spots or red spots. They all have different meanings. And sometimes, people, if you lift something heavy, you can break a blood vessel. So there'll be, look like there's blood underneath the conjunctiva and so on. So we can see a lot in the sclera. And remember that as a person works on their body, the sclera will clear up. The sclera should be nice and white. And so you can see lots of yellow, and usually yellow has to do with liver, and the pink usually has to do with the environment. So they might have allergies, or maybe if somebody was crying, they'll have pink. So there's lots of things. Blue usually has to do with their again circulation and so on. And so as a person's improving their health, the sclera will get wider and these little vessels will kind of fade out. So we don't look at all of them. We look at the, the brightest ones, the thickest ones, and depending on where they're going and how they're moving around, what they're doing, that tells us. Okay, so thank you for being here. I think I'm pretty much really close on time. Thank you for being here. My next class starts August 8th and it runs through December. I teach Tuesday and Thursday mornings on Zoom from 8 to 10 Pacific Standard Time. Everything's recorded. And so if you want to take a class and you're not going to be there live, you can watch the recordings and take the class by recordings. If you're going to miss here and there, you have a dentist appointment or you're going to get together with your kids or whatever, that's fine because it's all recorded and students can always come back. We have payment plans, lots of, we're very flexible. And I also teach level 3, which is advanced curriculum. I do lots of mentoring and tutoring, and I'm always teaching something. So if you're interested in the class, I'd be happy to have you. Okay, so thank you very much for being here tonight. And let me stop my share and see if anybody has any questions or comments.
Thank you.
I did have a question. Some of the eyes that had, it almost looks like that has a sunburn where it's kind of trying to peel off the fibers. You know which one I'm talking about? Like, I think one of the examples was like a blue iris on the slide that says this is what iridology cannot do.
Uh-huh.
What does that mean?
When it looks like it's peeling?
Yeah, it looks really, it's like a heavy white, inflamed. It's like kind of sticking up and there'll be like some wrinkles. It's like, it looks like you could peel it off.
Oh, so you might be talking about the fibers. So it kind of look like lightning, like it's thinner at the outside or just the fibers?
No, if you look at your slide that says this is what iridology cannot do.
Let me go back to that slide.
Okay. I think there was 2 that had that. I think it was the second one.
Let me see what iridology cannot do. Let's go back here and see if we can figure out which slide there's the purpose. There's the little chart. There's what is iridology, not that one, right?
No.
That's
No.
information on Dr. Jensen. There's how iridology is used. That one?
I think the next couple ones, this is like blown up bigger, but that was a little example. Yeah, so keep going. Keep going. Keep going. Keep going. Not really. No, not that one. This one. See how it's like all goopy, like you could peel it off? What is that?
These are the fibers. So, okay, so this is your stomach right here. This ring, see this ring right here? This is your stomach. Okay, and then this here, this is called a collarette. This is what divides the digestive system from the rest of the body. So inside here, you have the stomach and the colon. Okay, and then out here are all the organs. So these are all fibers here. These are
Why
all
do they
fibers.
look unhealthy?
Well, there's lots of spaces in here. There's lots of spaces, and that has to do with this person's subtype. Okay, so what we do is we look at the collarette, we trace the collarette, and that shows us the digestive system, and then we can see any of the markings on the outside here. These are all lacuna here. In the old days, what we used to do is we would look at each one of these and talk about each one of these areas, which would be very stressful for the client. Because basically you're saying that all of these areas need work. And so these are all areas that might need detoxing or might need nutrition that they're not getting. Okay, but we're also looking at subtypes. So this person would basically need to work on their glands. Okay, this person would need to work on their glands and would need to work on their connective tissue. And so that that is their genetic predisposition, is working on their glands. Maybe their glandular system's imbalanced, and maybe they've got some connective tissue issues, but we need to ask them about those things.
And on that left eye, so like let's say if a person did clean up their diet and stop using chemicals in their lifestyle and stop drinking alcohol or whatever, like would some of that stuff, some of that thick, white, chunky stuff on that eye clear up, or that's
Nope.
just gonna stay like that?
That's their genetic predisposition. That's who they are. Okay. So like I said about my eye, okay, it's not going to change. I mean, it might change a teeny bit. Okay. It might change a little bit, but that is who they are. Okay. This person has what we call connective tissue polyglandular subtype. Okay. So they're going to need to work on their glands. They're going to need to work on their connective tissue. And that's lifelong. That's something that they're always going to have to do. When you're working on part of your body that is genetically, it's a genetic tendency. It's something that it doesn't absorb nutrients or release toxins as well. It's always going to be something that you're working on. You're always trying to improve that area to make it more efficient, to bring it into balance, right? It's not something.
Are these eyes the pictures of, are these senior eyes? Are these a young person's eye?
These are not a senior. It has nothing to do with age.
Interesting. Okay.
But
Thank you.
these are really beautiful. I mean, from an iridology perspective, they're all beautiful. I don't want to say that one is more prettier than the other, but these eyes are striking. You know, if this person were standing in front of you, you would feel like they're penetrating you. You know, the feeling like they're penetrating you when they look at you. Very, very strong eyes, very penetrating. Beautiful. I mean, it's amazing how beautiful they are. And they have their things that they need to work on. It's different than what I would need to work on, right? This person would be dealing with stress in a different way than I would be dealing with it. Okay, it would affect them differently. Their digestive system is definitely different than my digestive system based on their eyes. Okay, based on their iris, their genetic predispositions are different. Their genetic predispositions are glands and connective tissue. Mine isn't. Mine is nervous and digestive. So I'm having to pay attention to my digestive system and my nervous system. This person, yeah, they've got some things with their digestive system probably, but for them, it's more glandular and connective tissue.
You said in the old way that you would kind of look at each of those lacunas and kind of review all the different organs that weren't absorbing nutrients and detoxing waste. Now, is that still really true? But that's just the way we don't explain it to clients now because it's too overwhelming.
We can still do that, but you'll never see that client again. They'll be still.
Well, I'm asking so many questions about these eyes because they look just like my mom's eyes.
Ah, okay. Well, there are multiple things. So we also look at the depth of those lacuna. You know, the iris is layers. There's 4 layers. So the top part, that's called that anterior border layer. That's where the color shows up. That's the very top here. And when you look in the eye, you're looking down into these lacuna. And so you can see this one's a little bit darker, right? This one's a little darker here. So some of these are darker. These areas are darker, like that right there. This little area is darker. It's going further down. That would be something I would talk to my client about, okay? Because when it's going down into the lower levels, it's usually something that is older, okay? Or something that is definitely not or may not be absorbing nutrients very well at all. It would be something that would need more work, okay? More balancing. Okay, so we usually look at pigments. We're going to look at something that's either very white or very dark, you know, and it's also a step-by-step process. So, you know, when I went and saw Chris, I thought when I went, and I had all these problems, you know, I had these problems. I couldn't eat anything, you know, I couldn't lay in bed flat. I was breaking out all over in hives. You know, I should have known, yeah, there was something wrong, but I went and saw him thinking that he was going to say everything was fine. And he did exactly that. Yeah, I mean, all the markings in my eyes, he just, you know, said everything. And I walked out of there and I cried all the way home. But I did everything he said. And with my personality, that's my personality. You could do that with me and I'll take action. Whereas somebody else, you do that to them, they'll fold up. Okay. They won't be strong. They'll just buckle down and just give up. Okay. But I did everything he said. I took all the supplements, I did all the detoxing, I did everything, and I got better. So, that's how it was done then. But now, it's a step-by-step process. You spend an hour with somebody and give them, it's a step-by-step. Now, that doesn't mean that this person is any healthier or unhealthier than I am. Just because they have a lot of lacuna, it doesn't mean anything. This person, it might be much healthier than me. I remember when I went down to Dr. Jensen's when I worked at his birthday, and I remember that he put pictures up on the wall, up on the screen, and there were pictures that we thought these people were so unhealthy. And he told us that, no, this person's perfectly healthy. And then he put a picture up there of somebody that we thought was perfectly healthy, and they had passed away. And he kind of blew us all away. And so that just showed us that just because it shows up in the iris, and that was then, all those years ago, just because it shows up in the iris doesn't mean that there's a problem. So if these look like your mom's eyes, just because there are lacuna or just because there is something in there doesn't mean that there's a problem. It really depends on the things that I said, how she lives, what she eats, what she drinks, how she thinks, who she loves, all of those things.
She's got poor foundations.
Yeah.
Yeah.
Yeah. Yeah.
All right. Well, thank you.
Welcome. I'm glad I was able to answer your question. Anything else? Any other questions, comments? Okay. Thank you for being here. Really appreciate you spending your time with me. And thank you for everybody out there in internet land and Zoom that's going to watch the recordings. I appreciate you spending the time watching the recording. And if you have any questions, please feel free to call me or email me and let me know.
I could do that. Actually, I do have a question. Once you log off there, it has nothing to do with the presentation today.
Okay.